April 2024. It's 9:30 a.m. Indian Standard Time, and people are joining in from around the world. Summers are starting, so everybody has a question how to handle the summer. We have seen temperature rising up to 48 degrees in India, and everywhere else we have this problem. So we have our expert today talking on this health problems related to heat. Let's prepare ourselves for summers. We have Dr. K.P. Chandra. He is joining in from Lucknow, which is the capital of Uttar Pradesh in India. Dr. Chandra is a fellow member of ICP, ISH, UPDA, EASD Netherlands, ISMN, IACM. He is also a fellow member of Indian Society of Chronomedicine Research Trust of Diabetes India. He was a senior scientist, Department of Drug Discovery, Clinical Research and Translation Medicine, Torrent Research Center in Gandhinagar. He has more than 25 publications, including original research, book chapters, patents, and review articles. Sir, we welcome you on this forum, and over to you.
Thank you very much, sir, for your kind words and introduction. And rightly said, we are into the summer and we need to prepare ourselves for disease or problems related to summer. So, dear friends, I am Dr. K.P. Chandra, and I work in Lucknow. So, I did my MBBS from Darbhanga Medical College, Bihar in 2002, MD from Indore in 2006. I did fellowship in diabetes from CMC Vellore 2017, and I have done MSc in advancing diabetes care from Birmingham University, UK 2023. I'm working as a director in Department of Internal Medicine and Diabetes Care at Gomti Nagar. So, well said, summer has come in, and we often see at least a couple of hundred people dying because of health problem related to heat during the summer. And we need to know what are the basic things about it. So what we will try to understand today is how thermoregulation does occur, how does it fails, and what happens with when thermoregulation fails. Then we will try to understand different disease entities associated with heat, which includes heat cramps, heat exhaustion, heat syncope, heat stroke, and then at the end we'll try to understand how can we prevent these issues. So our human body maintains a steady temperature through a balance of internal heat production and environmental heat loss. We all know for sustenance of our life, our body, our cells do metabolism, and as a byproduct of metabolism, heat is produced. However, our body maintains a constant temperature of around 37 degrees centigrade or 37.2 degrees centigrade, and to keep body temperature constant at that, whatever extra heat is produced, it is lost into the environment. This loss is basically through four processes. It is radiation, which accounts to minimal amount. Evaporation, around 20 to 25% of heat loss occurs by evaporation at room temperature. Then conduction is the major way of heat loss, and then convection. However, in extremes of temperature, body's thermoregulation may fail, and that may result in change of the core body temperature. So during winters, if adequate thermoregulation does not occur, our body may become cold and we will have problems. Similarly, during summer, when thermoregulation fails, our body temperature rises. Now let us see what happens in warm climate. So up to 37.2 degree temperature, or any temperature less than 37.2 degree, our body keeps losing weight. However, When temperature rises above 37.2 degree, the direct heat transfer from skin to surrounding stops, and the rather reversal occurs. So normally our body had to lose the heat, but when environmental temperature is more than 37.2, our body starts absorbing heat from the environment by way of conduction or convection. Now, at these temperature, usually evaporation takes a upper load. At a room temperature, evaporation accounts for about 20% of the heat loss. What happens that when we sweat, the water on our skin surface evaporates, and the heat required for evaporation comes out from our body, and that is the way we lose weight, we lose heat. However, when temperature rises, the component of heat loss through evaporation increases. So at higher temperature, heat loss is mostly through evaporation, and that's why at higher temperature we tend to sweat a lot, and after sweating, that water evaporates from the surface and it cools our body. When climate is humid, that is when moisture increases in the environment, this evaporative loss also starts decreasing. Now let us understand how this hyperthermia develops in our body. It actually results from body's inability to maintain normal internal temperature through heat loss, which may be because of compromised heat dissipation mechanism, or it could be because of abnormally high heat production. So high heat production can be because of increased metabolic rate. Apart from that, involuntary muscle contraction, seizures are other causes in which internal heat production increases. Heat stress can be caused by combination of environmental and metabolic heat also. So your body temperature, your internal heat production is high, and external temperature is high, and then you are not able to lose the extra heat that you have, and then body temperature starts increasing. Climatic changes have significant contribution to the risk of heat related conditions. Now let us understand what are the risk factors in a person which leads to heat related illnesses. So if a person is not acclimatized to working in warm, humid, or hot weather, and if he works for longer duration in hot environment and there's dehydration, there are always risk of getting heat related illness. There are certain skin disorders and other medical conditions in which sweat production or evaporation is compromised. There also heat loss is compromised, and that may lead to abnormal heating of the body. Other causes include obesity, prolonged seizures. In seizures, we all know that involuntary muscle contraction lead to heat production. Hypotension and reduced cutaneous blood flow with reduced cardiac output is another risk factor. We all know that heat loss occurs from skin, and heat reaches the surface of body through the adequate blood flow in the capillaries under the skin. And if there is hypotension, which leads to reduced cutaneous blood flow, it would lead to less loss of heat, because heat is not able to reach to the surface from where it could be lost either by conduction or by evaporation. There are certain drugs which increase metabolism that may cause. There are illicit drugs which increases muscle activities and generate body heat. They can also predispose. Apart from that, people at their extremes of age have compromised thermoregulations. So, a child less than a couple of years, or elderly person, or those who are chronically debilitated may have higher risk of getting heat-related illness. So with this background, we begin with the first condition, which is seen very commonly in our day-to-day life, and that is heat cramps. We often see players during, cricket. People are fan of cricket, and we do see during summer a batsman who has been batting for a long duration in a hot, humid climate starts getting cramps. So basically, heat cramps are involuntary muscle contraction which are painful. It is associated with exercise. It may occur during exercise or immediately after exercise. Usually, heat cramps occur because of dilutional hyponatremia. We all know during exercise or during sports, body excretes a lot of sweat to keep body cool, and the sweat constitutes of water and electrolytes, particularly sodium. When this replacement of the fluid is done only with water and adequate electrolyte is not replenished, that leads to dilutional hyponatremia, which results in heat cramps. So what happens in heat cramps? You will see that the muscle is lumpy, hard, and tender, and you can notice twitching in the muscle. However, body temperature is usually normal or slightly increased because sweat mechanism is working efficiently. Sweat is there, so skin will be cool and moist, and usually vitals are stable. So how to treat it? The first and most important aspect is stop the activity which is causing you the cramp. So stop the activity which is causing increased production of heat in the body. Then person should be moved to a shaded person in a cool environment, and we need to replenish electrolytes. So provide oral isotonic or hypertonic rehydration solution to replace both electrolyte and water. Oral salts are usually not recommended. And for muscle spasm or cramps, what we need to do is we need to either give a gentle massage or gently stretch the cramped muscle so that it becomes relaxed. So that is what we have to do. Another important thing is that once heat cramp is occurring or has occurred, person should take rest at least for a couple of days, because it takes time for the body to replenish the electrolyte which has been lost. So many times we do see players going for the play or strenuous activity the next day. It is not recommended medically. Medically, a couple of days rest is what it is needed before resuming to strenuous activity in the heat. Now, I'm sorry, there is something. Let me restart it. There is something.
Nope.
I hope my slides are visible once again.
Yeah, we can see that flights.
Hello, am I audible?
Yes, sir, you're audible and we can see your slides.
Okay, so Heat cramps. How to treat heat cramps? So we need to bring the person to the rest and then move the patient to the shaded area. Oral rehydration has to be done and rest for at least 2 days. Now let us move to the next one, heat exhaustion. Heat exhaustion occurs when there is dehydration, sodium depletion, or isotonic fluid loss with accompanying cardiovascular changes. So here the blood pressure goes down because of the fluid loss. It results from prolonged strenuous activity in hot environment without adequate water and salt intake. So heat exhaustion is diagnosed based on clinical findings. The core body temperature usually remains normal, slightly increased, but it is usually less than 40 degree. Since there is hypotension, so person will have tachycardia, decrease in blood pressure, but skin will be moist. Additional symptoms may include nausea, vomiting, malaise, myalgia, hyperventilation, thirst, and weakness. At times, there are CNS symptoms associated with heat exhaustion, which includes headache, dizziness, fatigue, anxiety, paresthesia, impaired judgment, and occasionally psychosis. Now, if heat exhaustion process progresses and sweating mechanism is disrupted, it will progress to heat stroke. And when heat stroke occurs, mental status starts declining. Now, what are the treatments for heat exhaustion? Move the patient to the shaded and cool environment, provide adequate fluid and electrolyte replacement, initiate active cooling. Physiological saline or isotonic glucose solution may be administered intravenously when oral administration is not appropriate. So patient may be vomiting or patient may have some disorientation, patient may have nausea and they may not tolerate oral administration, and in those cases intravenous fluid supplementation has to be done. Once again, a rest of at least 48 hours are required for proper rehydration. Now moving to heat syncope. Syncope is a transient loss of consciousness with a spontaneous return to normal mentation. So when a person is standing in heat or exercising in heat, postural hypotension occurs, which leads to compromised blood flow to the brain and ultimately culminates into loss of consciousness or syncope. Exercise associated postural hypotension usually occurs during warm or summer seasons. Usually it occurs during or immediately after exercise. Once again, the treatment of heat syncope is similar to heat exhaustion. Fluid replacement has to be done. Here, usually we see that patient's skin is cool and moist. However, because of low systolic blood pressure, pulse may be weak and fast. The treatment requires moving the person to the shaded and cool area, fluid and electrolyte replacement. Now moving to the most severe form of heat-related illness, that is heat stroke. It results when the core body temperature crosses 40 degree. So your heat dissemination mechanism fails completely. Body becomes red, hot, dry, warm. So skin, there is no sweat mechanism. Core temperature rises over 40 degree and cerebral dysfunction sets in. This is what characterizes heat stroke. It may present as one of the two forms, classical or exertional. What we are going to talk about is exertional heat stroke, which usually occurs in healthy person who undergoes strenuous exertion in hot or humid environment. Classical or non-exertional heat stroke occurs in patients with impaired thermoregulatory mechanism or in extreme environmental condition. Let us understand how heat exhaustion progresses to heat stroke. So we have seen that in heat exhaustion, the blood pressure had decreased, but there was rapid pulse, nausea, vomiting, but sweat mechanism was still there. There was excessive sweating, and skin was usually cool, pale, and calming. However, in heat stroke, this sweat mechanism stops, so there is no sweating, and skin becomes red, hot, and dry. Person usually loses consciousness. There can be throbbing headache, nausea, vomiting. Heat stroke usually presents with symptoms which may include all the symptoms that we have seen in heat exhaustion. In addition to that, neurological symptoms such as dizziness, weakness, emotional lability, confusion, delirium, blurred vision, convulsions, collapse, and unconsciousness may happen. Physical examination finding may be variable. Exertional heat stroke may present with sudden collapse and loss of consciousness followed by irrational behavior. As said earlier, sweating may not be present. Heat stroke is basically a life-threatening emergency, and we should be vigilant in monitoring end organs, which include kidney injury, liver injury, metabolic derangements, respiratory compromise, coagulopathy, and ischemia. Let me tell you, initial laboratory finding may be non-specific. So these people who have suffered heat stroke has to be followed for a couple of days at least to monitor these injuries, and if these injuries are occurring, preventive measures have to be taken. The complications which usually occurs due to heat stroke include hypovolemia, cardiogenic shock, metabolic abnormalities, cardiac arrhythmias, coagulopathy, acute respiratory distress syndrome. So because of damage to lung parenchyma because of heat, ARDS may develop. Hypoglycemia, rhabdomyolysis, seizures, organ dysfunction, and infection may occur. At times, because of muscle loss or injury to muscle, severe edema may occur, which may progress to compartment syndrome. Now let us talk about heat stroke management. Since person is usually unconscious, the first thing that we need to take care is ABC: airway, breathing, circulation. Apart from that, treatment should be aimed at rapidly reducing the core body temperature within 1 hour while supporting circulation and perfusion. We need to monitor circulation and perfusion by pulse oximetry, cardiac monitoring, and we should measure core body temperature. Circulatory failure usually occurs because of hypovolemia, and that would require adequate oral or intravenous fluid administration to ensure adequate urine output. Now, these are the methods by which cooling can be done. We may sprinkle water on the body and then put the person under fan so that evaporation, loss of evaporation occurs. Removing excessive cloth, immersing in water, or putting cool wet towels, ice packs are some of the methods which can be used. So choice of cooling method really depends on what can be instituted fastest with least compromise to overall care of the patient. Evaporative cooling is preferred for non-exertional heat stroke. Conductive-based cooling is for exertional heat stroke. What is evaporative cooling? What we do, we try to expose the maximum surface of the body so that evaporation occurs from the body surface. So this is non-invasive, effective, quick, and easy way to reduce temperature. Usually, person is undressed and placed in lateral recumbent position, and if person is conscious, then hand and knee position is brought so that maximum skin surface is exposed, and then we may sprinkle water on the body of the person, and person can be put under the fan. That is how maximum evaporation can occur. Conductive based cooling usually requires cold infusion, gastric or bladder lavage. Ice water or cold water immersion is preferred method for cooling exertional heat stroke which occurs in field. Ice packs are most effective, and we should try to cover almost all part of the body by ice. Intravascular heat exchanger catheter systems can also be used. Now, there are certain precautions which has to be exercised when treating heat stroke. One is severing should be avoided, because we know during severing, contraction of the muscle will occur and that will lead to increased heat production, and that is when effective cooling will not happen. So at times medications has to be used to suppress severing, which may include magnesium, quick acting opioid analgesic, benzodiazepines, and quick acting anesthetic agents. Skin massage is recommended to prevent cutaneous vasoconstriction, since we need adequate blood flow into the capillaries, and exposure to cold water may lead to cutaneous vasoconstriction, which may compromise heat loss. Antipyretics are of absolutely no use. So if person has got heat stroke and temperature of say 41 degree, and giving paracetamol, aspirin, acetaminophen, that is ridiculous, because we know thermoregulatory mechanism of the body is not working, and it will not be effective. It would rather damage the organs which are in compromise, particularly liver and kidney, and hence it is contraindicated. Treatment of heat stroke should be continued until core body temperature drops to 39 degree. At the end, we'll move about prevention, how to prevent heat related injuries. Education is most important. We should know, or the population should know, what are the risk factors associated with heat and how to recognize heat related disorders. So individual may take steps to reduce personal risk factor to gradually acclimatize to hot environment. Similarly, prevention of occupational heat related illness is an important step which should be adopted in industries or during sports. Comprehensive preventive programs should assess personal risk factor, estimated wet bulb globe temperature, workload, acclimatization status, and early symptom recognition are very much important in prevention of the disease. Similarly, in sports, coaches, athletic trainer, athletes, parents of young athletes must be educated about heat-related illness, specifically about prevention, risk, symptoms, and signs, along with treatment. Medical evaluation and monitoring should be used to identify at-risk individual and weather conditions that increases the risk of heat-related disorder. Apart from that, those who are physically active in hot environment must increase fluid consumption during and after physical activity. And fluid consumption should not be limited to water only, but a balanced electrolyte fluid should be given. Close monitoring of the fluid, electrolyte intake, and early intervention are recommended in situations necessitating exertion or activity in hot environment. At the end, I would like to summarize today's talk that there is a spectrum of preventable heat-related illness, which include heat cramps, heat exhaustion, heat syncope, and heat stroke. Heat stroke is the most serious form of heat-related illness in which hyperthermia, along with cerebral dysfunction, occurs in person with heat exposure. The best outcome from any heat-related illness is early recognition, removal from hot environment, and initiation of rapid cooling. Delay in the cooling may result in higher morbidity, mortality in patients with heat stroke. And one of the important messages that I want to give, the best cooling method is whichever method which can be instituted fastest with least compromise to the patient. Thank you very much for your patient hearing. This is the hospital where we work and we try to bring world-class services. It is Health City Vistar in Gomti Nagar Extension, Lucknow. Thank you very much for your patient hearing.
Thank you, Dr. Chandra, for excellent presentation and insightful information about the heat and how to handle that. I welcome Dr. Chong, the chair of CMAAO, to take over this session.
Thank you, Dr. Chandra, for your interesting lecture on heat disorders. In Singapore, we have a lot of experience with heat disorders because we have a citizen army here. We have a reservist army. All of us have to do national service, we call it, for 2 years. And one of the, earlier on when I was doing my national service and my reservist training, we used to have quite a lot of heat disorders in our soldiers. Because we are at the equator, it's very hot. And so during training, there's always the risk of heat disorder. And so in our army camps, we all have a body cooling unit. It's basically a series of pipes, right, with very high pressure and with very fine holes, so they produce a mist of water coming through. And then we have a giant fan, and the patient is put onto a trolley and of course stripped down. And we have a very fine mist aerosol on the body with a powerful fan blowing and evaporating all the fluid off the body, the patient's body. And we also monitor with a rectal thermometer. So this is what we have, body cooling unit. And every time that we have a heat stroke patient, a very serious one, you're right, recognition is very important, because a lot of times we don't recognize the fact that the patient has had a heat stroke. You know, they could be a little bit dizzy, a little bit confused, and so on, or a little bit. And sometimes the army officers or NCOs think that the guy is trying to pull a fast one. You know what I mean? So we have cases where they was not recognized, and recently, so we've instituted a lot of changes in our approach to heat stroke in Singapore. For example, we try to do the very strenuous training at night. So, for example, our route march, which is a 10-kilometer, 20-kilometer route march, we start at 6 p.m. and do it through the night instead of during the day. So these are some of the things. And we have a water parade. Before we go on a big exercise, everybody lines up the night before, and on the day itself, everybody's drinking water in front of the officers. So these are some of the things we did, because heat stroke is very serious, and yeah, and whenever there's a heat stroke, we will actually evacuate the patient by helicopter. We use a military helicopter and fly him directly to the big hospital, because some of our training areas are a little bit further out or off the main island. So these are some of our experiences with heat stroke, which are very, very useful today, resonated with with me when I listened to your lecture. Yeah, those are my comments on heat stroke. So yeah, it's very relevant. And recently, so for the longest time, for the last few years, we didn't have much more heat stroke patient, but we had one recently, and the patient died, a young man in the army. And again, like what you said, it wasn't recognized. And this is despite, very interesting, despite the exercise being held at night, and he still had heat stroke. So it is what it is, you know, and very, very unfortunate, and of course very devastating. We've also seen the heat stroke patient in ICU, and they're devastating, multi-organ failure, terrible disease, you know, and also avoidable, so easily detectable and avoidable if early. So thank you very much for your most interesting lecture. Any questions from the floor?
Yeah.
Hi, good morning, Dr. Chong.
Yes, Dr. Akhtar.
Just want to thank you, Dr. Chandra. It's an excellent presentation, a lot of information on heat stroke. Just like to know the cramps in a diabetic patient usually complain, you know, they got cramp at night, sometime when they're resting. Or what is your advice for them? Thank you.
So cramps occurring in diabetic patients at night usually is because of some electrolyte imbalance here also. At times, patient may have hypocalcemia, and patient may have hyponatremia also because of drugs. So these are the couple of things which are usually cause of cramps in diabetic patient and at night. So what usually we do is that we do give calcium supplementation, magnesium. Calcium, magnesium supplementation is usually common in these patients, and which help them. Any other, any other inputs from others?
Monica?
Dr. Chandra, thank you again for a great presentation. So I don't have a lot of clinical experience with heat stroke because I tend to be in a very cold part of the world. I'm lucky when I get daylight hours because we're so far away from the equator that we thrive in the sun, and we are sun worshipers. We go out whenever we can. But what you said, I think the pearls that you shared were fantastic in terms of understanding and distinguishing among the different heat conditions. I think this is a topic that I don't think is refreshed very often. We see it and we're not seeing it. Maybe we're not recognizing it. And especially recognizing the role of NSAIDs and acetaminophen, or the lack of role and the potential harm, I think is very important. But even if we're living in an area far away from the equator, we are always visiting areas close to the equator. And I think we need to be very respectful of the issues. I did, while Dr. Chang was talking, I did share a few links. There was a really interesting article from 2014 about the Singapore Army and their cooling system.
Yeah.
There's also a PubMed cited article about the approaches of heat. And then I put in something from the UK about diabetes and cramps and heat management. So I think that even as you were talking about the presentation, that we always have to understand the context of the presentation of heat-related injury in the context of the individual, as well as their medical conditions, because it may not present with all the signs and symptoms that you had discussed. And so, or it might be, might come across as a more common condition that we might miss. But your presentation was fantastic, and thank you for everything that you shared with us today.
Thank you very much,
Thank
Dr.
you.
Chandra. It was very illuminating, as always, to visit this topic for us in Singapore. We're all quite familiar with it in some way, having experienced it one way or other.
Yeah, I thought it was important because we usually, at least in India, we usually see patients with illness related to heat, because the type of temperature that we are going to have for next couple of months is really going to be 40, 45 degree, and at times it reaches up to 49 degree. And we do have, workers in our farm, workers in our industry, who are exposed to this. And usually people are not able to do the things properly. And rightly pointed out by Dr. Monica that, usually paracetamol is being given, which is contraindicated. Rather, other methods of cooling has to be done. And here I would like to, tell you about one of the classical heat stroke, that is non-exertional heat stroke, that occurred in one of the patients which was admitted a couple of months back. And she was admitted under a neurosurgeon for some neurosurgical problems, and she started having temperature around 41 degrees C or so, and she started having irrelevant talk, and people were giving paracetamol 1 gram every 6 hours. Then NSAIDs were given, even steroids were given to decrease the body temperature, but it didn't work. Ultimately, the thing which worked was effective cooling. So that is what we need to know, that even in our clinics, when there may be non-exertional heat stroke, the preferred method of decreasing body temperature is effective cooling rather than giving all those drugs. Thank you.
I wanted to say one more thing. I think that's important, is that, public awareness of how to avoid heat-related injuries in terms of appropriate clothing in weathers, being aware of being able to track the weather, knowing how long to be out in the weather, for employers to be able to protect their employees if they know that it's a hot day, I think are all very important things to consider as well.
So this is the I was just sharing screen, and this is the article of a boy who national service boy who died, and they were doing a 8-kilometer fast march, and this was at night, and he got heat stroke, and it wasn't recognized by the officer, who thought he was malingering. So very sad, very, very sad. So we do get these sort of things once in a while.
I agree. Early recognition is very important.
Yeah. So we hadn't had a heat stroke case for a long time because we move all the exercises to the night. But hey, it still happened and wasn't recognized by the officer. So very sad. Yeah. Okay. If there are no questions from the floor, without much.
There's one more question. In the Facebook, it says that does is heat stroke dangerous and life threatening, and also can it cause a heart attack if somebody is doing workout?
Yeah, I have already told in the complications. Heat stroke is really life-threatening, and if it is not recognized early, I would say mortality is around 1/3. And we have seen that there are electrolyte imbalances, there is hypotension, cardiac arrhythmias may occur that may lead to sudden cardiac death also. So yes, it is important and it should be recognized. And during warm, I would say moist, gym environment, if you are doing excessive exercise, lose the heat or cooling mechanism, there are chances that cardiac arrhythmias may precipitate and that may cause death. I agree.
I think we don't have any further questions. Anyone else has a question over here on the forum? If not, then otherwise we will wrap up the session quickly. It was a quick 45-minute session and it was a very crisp and good information coming out. Okay, so
thank you, Dr. Chandra, very much again for your time. Most illuminating and always a pleasure to hear speakers. Yes, thank you. Thank you very much.
Thank you, Dr. Chandra, for joining in.
I feel privileged. Thank you.
Thank you.
Thank you.
Thank
Bye-bye.
you, everyone.
Thank you so much. Thank you.